Welcome, everyone. I'm so glad that you are here and joining me or watching this at a later time. I'm actually live right now. It's my 7 p.m. Monday night live stream on different mental health topics that are impacting believers. And tonight we are wrapping up a series I've been doing for a little over a month, but technically like 4 weeks, talking about suicide prevention because September has been Suicide Prevention Month. And then October, the reason why that was on my mind is that October 10th was World Mental Health Day. And so, still in the spirit of good mental health and bringing together Christians who care about mental health and want other people to take their mental health seriously, this is the channel for you. This is pretty much all I talk about. I have been a therapist for 16 years and I've been a Christian a whole lot longer than that. And those are two things I feel very, very passionate about. So, this channel is here to provide free resources to you and discussions about really important topics so that at the end of anything that you watch, you're getting that much closer to looking at your mental health from a biblical perspective. Now, I know that there might be some Christians that think, well, of course, I want to see things from a biblical perspective. But something that I have been learning just fairly recently is that even well meaning Christians don't necessarily have a biblical perspective on things because what it requires of us is something that honestly not a lot of people, myself included, have always had. And that is a knowledge of the Bible, knowing what God's word actually says about all the important topics because it's there for us. It is there. Anything that we want to know about any important topic, we can find God's wisdom and his inspiration in the Bible. And so I have been on a deep dive over the last couple of years, actually, probably about 3 years, and just blows me away every time when I realize that there's so much in the scriptures about the way that we think and how God is very passionate about us taking our thoughts captive and knowing what that means and so many other things. So um, I don't want to, I just never want to be that person that is begging people to watch my videos or to subscribe. That just doesn't feel comfortable to me at all. But I will also tell you that I am going to ask that you will share this and get this in front of the right people because the more and more I am realizing the great value that is in YouTube, it's that it's going to circulate in the algorithm to other people, the more that people are giving it a thumbs up and the more that people are commenting on it. So that is my ask. There's no guilt associated with this. I don't need this for anything other than I just really want people to know. I want people to know what it takes from a clinical perspective, how to manage your mental health and to be a believer at the same time. And those are two worlds that we don't often bring together, and they really, really need to be. So, for the last 4 weeks, this is week 5. Hi, Electra. Glad you're here with me tonight. For the past 4 weeks, hi, Danelle. I'm glad you're here. Awesome. We're off to a really good start. We got a couple of people joining. This is a tough group to join into. I get that. Sometimes we've talked about really or much more lighthearted topics. The last month has not been that. And at the same time, it's been super important. It's probably been the most important thing that I've ever talked about on YouTube for sure. So I'm glad that you guys are here. And I was just sharing and encouraging you guys to find a way that feels comfortable to you to get this in front of your audience. Everybody has one, whether it's your friend group or it's your family. There's so many different angles that you can take in this. And as someone who, as a professional, cares so much about the family system and bringing communication together, I just want to tell you that whether you are listening to this because you are a family member and you know that you have loved ones that struggle with their mental health and you want to know how to help them, or you are the client or patient that really wants their family to understand what you haven't been able to articulate, this is a great way to do that because it doesn't have to be you saying the heavy and the hard things. It's simply you putting me, the stranger, in front of them and saying, listen to what she has to say. Of course, that's assuming that you agree with it, but it's okay. You don't have to agree with everything that I'm saying. But I do hope that you're able to take away something of significance from every or most videos that you watch, but especially from this series. We've covered so many things in the last 4 weeks, and tonight is the conclusion to that. It doesn't mean I'll never talk about suicide prevention again. I hope I'm always talking about it, because one of my goals is to bring the suicide rate down and to bring the biblical worldview up. And those two things they're really big goals, but they're they're very worthwhile goals. So how you can help with that, how you can help achieve that mission. Number one, listen to the things that I'm sharing, take notes, and do something with that information yourself. Do something where you are taking that into your week and into your life and into your therapy sessions. Talk about it with your therapist. There's no conflict here of you listening to something that I have to say and then, being treated by somebody totally different and letting them know something that you heard that maybe you are in their presence, you're able to actually digest and to process it and say, I don't know what to do with that information, or I've never thought about my life in that way. Help me work on that. That's what we're there for. So no matter what perspective it is that you're watching this, do something brave. Tell your family and your friends that there are things that yet they still don't know. They could be working at this with you for a long time and still find things that they need to be working on, because that's all of us, right? That's you, the person I'm talking to right now that's in therapy, and you've been working on goals for years and you keep reaching those goals, and then you realize there's something else I need to be working on. That's why I think that therapy really is for everybody. The problem is most of us tend to wait until, we're in really, really dire straits. And we're going to someone because our relationship is on the rocks, our mental health is on the rocks, we're being forced basically to go into treatment. And none of those are comfortable reasons. They're good reasons, but they're not comfortable reasons. We need to be looking at things from more of the perspective of being proactive. How can I get in front of what I'm seeing? How can I learn more? Because my mental health is important to me. How can I learn so much more that my toolbox and my kit, my tool belt is just becoming more and more plentiful. We just need that. I mean, any of my patients that would be watching this knows that I've used the analogy before. You cannot go into a project that you're working on, or like a move, going into a new home, and just bring a hammer. You have to have all sorts of things that you're using, right? You have to be equipped for basically anything that you're going to need. Something's going to come up. And I see our mental health exactly the same way. We can't use the same thing for everything that we are feeling. It just doesn't work. Sometimes you're going to try something that's worked over and over and realize I've either outgrown that, this is a very different symptom, or it's a different intensity of that symptom. And so I've got to, up my my level. I've got to up my my insight of what it is that I need to be using for this particular thing. Mental health changes over your lifetime. And so as a result of that, if we are people that want to grow and to be the very best self that we can possibly be, then we never need to be okay with just thinking we have arrived. We've never arrived at our spiritual life, right? No one ever gets to the place where they say, I know everything about God I need to know. I'm putting it all into practice, and there's nothing that I have not looked at or talked about. Sin is completely out of my life. There's no stumbling blocks. That's no one. And because that's how we are at such a deep personal level with our Creator, that's exactly how we are as people. So there may be things that you are hearing tonight that you've already heard. If so, that's great. That's great news. That means that you are either in really, really good care, or you've been doing a lot of reading. Because what we're going to talk about, this doesn't come to the average person as just regular knowledge. And so some of what I'll be talking about tonight that I'm kind of mixing in with our conversation is some CBT, cognitive behavioral therapy. That is my most favorite modality of treatment. It's what I've seen the most results in with any patients that I've ever worked with. And so I'm going to be kind of intermingling that with, because it's so effective for so many conditions, that I'll be talking about it from the perspective of how does it treat suicidality? How does it treat self-harm? And what you might be realizing as we're talking tonight is maybe, just maybe, you thought that you were engaging in CBT and you really were not. That has happened to many of my patients before, where they're coming to me and they hear that that's something that I do. And they say, oh yeah, I've already done that. My last therapist did that. It didn't really help. That's like saying that you've been on a diet before and it didn't work. There's so many things, there's so many factors and variables to that, right? What kind of diet was it? How long did you stick to it? What kind of coaching, what kind of support did you have? Like, there's so many things that are a part of that. And that's exactly how CBT is. I'm grateful to say that it does treat just about everything. There's a few exceptions to that rule, and it is highly, highly effective. And so when patients are struggling with chronic self-harming urges or suicidal thinking, this is always my go-to, but this is what I really just hunker down on, helping to help them understand. And we're going to talk about that for sure. But there's something that, and again, I want to say, as I'm pulling something up on my phone, I want to say that I know that this is a very hard topic for people to engage with, because nobody really wants to, they don't really want to share that that's their struggle, that that's something that they are dealing with. And so it's, you want to stay, a lot of people want to stay really anonymous. And I completely understand that. I am going to try my hardest to anticipate what you might be thinking and what you might be asking. I just realized my light went off. Okay, there we go. I'm going to try to anticipate what those questions might be and what those concerns might be, but I realize I am just as fallible as most people are in this area, and I may not. And I want you to please feel comfortable asking whatever it is. If you want me to come back and go back to something that I've already shared, we've had some really good questions when they have been asked. We've had some really, really good questions in this area. Okay, let's see. What I wanted to start off with, because like I said, I've talked about a lot of different things. I've talked about assessment tools. I've talked about resources. I have talked about things that put people at risk. And so I'll try really hard to kind of dip back into some of those things that make a person high risk. Because one thing that I haven't talked about that puts a person at high risk for a lot of things is when they have a trauma background. Not that alone, but when a person has a trauma background and they haven't received treatment that really benefited them in that place. So in other words, what I'm saying is, really good treatment for trauma is going to help that person be able to repackage the version of what happened to them in their mind, so that when they're reliving it, it doesn't sound exactly the same, which means it doesn't feel exactly the same, and that doesn't produce the exact same symptoms. So if that hasn't been addressed, it does continue to put somebody at a risk. I've mentioned before, when you're a family member, when you have recently completed any sort of inpatient or residential treatment, for any reason. I'm not sure if I said that one of the last times that we were discussing this, but it's really for any reason. Clearly, it's if you've been inpatient for a mental health related behavioral health reason, because obviously there's a lot of impairments going on and you're starting new medications and you haven't had a chance to get used to those things. But even if someone has been, excuse me, I knew that was coming. Even if someone has been hospitalized, let's say for a physical reason, but they've been in the hospital for a long time, Maybe they had surgery. Maybe they realized that they didn't really have as much support as they thought they did. Their family didn't come to see them, or there was conflict, while in the hospital, or it just brought to light, issues or diagnoses or health concerns that they really weren't expecting. Everything getting accustomed back to real life is really difficult for people. And I want you to just think about it as a very big vulnerability. Okay, so whether it's you or it's someone that you care about, when they are leaving a hospital setting for an extended period of time, like something outside of like a day surgery, you just need to be careful and watch that person, because they've been at a deficit physically, emotionally, mentally, spiritually. And so it's just important to check in with somebody. And so I'm going to share something. This is why I'm looking at my phone, because I have had the honor of treating 2 patients in my career so far. 2 patients. I've had the honor of treating them. Their stories have been tough, and these are 2 parents, 2 separate families, but 2 parents that have lost a child to suicide. And although I have worked with many, many people in my career that themselves, they have experienced suicidal thinking and even acted, they've had attempts and things like that, self-harming urges as well. And I've had several people that have a family history of suicide. There really have only been 2, and I'm grateful to say that. There have been 2 people that I've worked with that have been so directly impacted by suicide that I just reached out to them and asked if they would let me share any of their story or any of their words. And they both were very, very gracious in letting me do that, because although the pain that they have experienced has just been second to none and excruciating beyond words, and like you've heard me say, like not like any other kind of loss that a person can experience. It's a very unique kind of loss. They want to help people. They want so much for their experiences and their stories and the things that they look back on and realize in a healthy way. They want other families to hear that and to be encouraged by that and to be able to make decisions that will have a very different outcome for their family. So I'm just going to read from this anonymous patient here. I'm going to leave any names out if they've listed any names. Below are some personal feelings and thoughts of how my son's passing has affected my husband, myself, and our family from my perspective. I hope that it can be helpful to anyone who is feeling desperately hopeless and how they are loved and needed by their family. As parents of losing our beloved child by suicide, I'm sharing what we live with in our daily lives. Our hearts have a canyon carved through it, and that is filled with waters of debris, sadness, pain, failure, loneliness, fear, confusion, and this is just to name a few. At any moment, it can be a flood, but always a flow. The family unit is changed forever, each living with their own suffering and pain and grief. It is so hard to know what each one's needs are, which adds to the overall dysfunction of the family, the fear, the anxiety that this could happen again. To survive it is imperative. I'm sorry, let me read that differently. To survive, it is imperative to find a helper that lends you to comfort and to the knowledge that you are not alone. Your Heavenly Father, His Son, and the Holy Spirit intimately know you and will lead you, comfort you, and show you the way forward. Don't give up. And that's in all caps. Heaven awaits you, and therefore the heartache will subside, and we will be reunited in the love of our Father in heaven. Knowing verses in God's Word is critical to get through the waters of this type of loss. Here are just a few that I keep in my memory bank. Matthew 11:28 through 30. Matthew 6:33 and 34. 2 Corinthians 4:16 through 18. Numbers 6:24 through 26. And this person is saying that their prayer for their family is number 6, 24 through 26. And I'm sorry about kind of stopping and starting in that. Like I said, that's from a mom. That's a mom's heart years after this has happened, and telling you that it's a daily struggle. Why do I want you to know these things? Why does this person want you to know these things? Because in that moment, or those moments or those days where it just seems like it's going on and on, that you are, having these thoughts of not being around, not being able to face the pain, the hard feelings that you might be experiencing, you're not thinking any of this, right? You're not thinking of any of these things. Your brain isn't allowing you to, because a rational brain would not have these thoughts, right? It just wouldn't be supported by that at all. And I know that, but I know that there's many, many people that want to try to be super, super rational and even lean into their own feelings by producing guilt and shame within you, because they don't know what else to do. They don't know what else to do. And so that's what I want to do, is to be able to equip people. That's why I have a video on the assessment that I use, the Sprite assessment, because you don't have to be a clinician to do a good job. I realize that this is taking me years to feel as comfortable as I do, to have the experience that I do, to have the just the ease at having these kind of conversations with people. It definitely was not always that way. So don't set yourself up for an expectation of you're going to follow exactly what I've been talking about in these videos and it's going to come off, flawlessly. It's going to be awkward. It is going to be awkward. And you might want to practice the things that you've heard me talk about outside the moment. But just remember this: you do not have to be a clinician to be able to do a pretty good assessment, an assessment that leads to a truly clinical assessment. And so this brings up another point. You've heard me talk in this series about the importance of checking in with your family members. I have a whole video that is just on that idea. What does it mean to check in with your family members? Why do we do that? Now I'm bringing it into the context of someone that you're concerned about, someone that you think could be suicidal. They might be showing some of the risk factors. They're just not acting like themselves. You have reason to believe this. And so you want to be able to ask something. And you've heard me say to ask that person directly, are you having thoughts of harming yourself or somebody else? Or are you suicidal? Or are you thinking about taking your life? Any of those things I've said, directly say this to somebody, because it does, in my experience, it's rendered really good results where the person that I'm asking feels like I just took a burden off of their shoulders by asking them the very thing that they really wanted to tell me about, but they just didn't know how to bring it up. And they didn't know how comfortable I would be with it. They didn't know if I would just, rush them off to the hospital in handcuffs. So I'm telling you what I've been trained to do in that respect, which is just address the elephant in the room and just ask them. All of that's true. I'm not changing that at all. But what I'm adding to that tonight that I think is of great, great value is that you might ask somebody that question. In fact, I've just been reflecting on the cases that I have dealt with where it was one of my patients, or, I heard about this case from somebody else because we talk about cases with other therapists. And I know that the loved one that's getting treatment said, I asked my loved one, I asked them this question, and they told me no. That's always bothered me. I've always really wanted to understand, because here I am telling you to do this, and then some people are saying, I did that, and yet this still happened. No, I'm as human as you are. I can't explain everything. I'm never going to understand everything, but I do think I've got this correct when I tell you this. It's important to realize that for some people, asking them directly Are you suicidal? Are you having these thoughts? They still might say no, and they are being 100% honest with you. They're not trying to mask anything because, and this is what takes us to the CBT piece, so many people are not really aware of their thoughts. So when you were to ask them, are you suicidal? Are you having thoughts of ending your life? They might tell you no, because the thoughts that they're having don't quite fit that profile, but they're still suicidal thoughts. And not everybody's going to understand that. Let me give you an example. If I myself, if I have thoughts on a regular basis that sound like this in my head, you're such a burden to everybody. You're always causing problems. You have really made a mess of your life. How are you going to get out of this now? You always seem to frustrate people. You're always going to be sick. Things are never going to get better for you. There's really no hope. There's no point of any of this. If I'm used to having any of those thoughts on a daily basis, do you know that I'm not going to see that as suicidal? I'm going to think that's normal for me. And so if you were to ask me, are you suicidal? I could honestly look you in the face and say, no. So I want to change what I said earlier. Like I said, you can still ask that question, and I hope that you do. And I hope that you practice it so it comes off confident and calm, more than it would if you just blurted out something. And I want to add to that to ask them, what have your thoughts been like lately? Can you tell me some of the thoughts that are in your mind? What are some of the thoughts that you remember having today? Any of those variations will tell you so much. This is what I do with my patients on a daily basis. I just haven't necessarily tied it together for the perspective of this video. Thinking about how, when you've done something as long as I have, sometimes you just take for granted that this is what you do. But I started thinking, this is what the average person does need to know. That if you were to ask somebody any of those questions the way that I did, then they're going to tell you so much by either telling you their feelings instead. So if you were to ask me that again, here's the role play. You're asking me that, and you're saying, well, tell me what some of your thoughts have been. What are some of the thoughts you remember having today? I might say, I don't know. That's the top answer, is for someone to say, I don't know. Then they might, if you kind of press more, they might say, I don't know. I feel overwhelmed. I feel sad. I feel a lot of anxiety. Then what I just told you in that is that I don't know what thoughts are, because I told you all my feelings. And that's an important conversation to have, right? I don't know how far you'd be able to go with that, because again, that takes a lot of clinical knowledge and even skill wrapped into all of that. But I think it would help push the conversation forward if you were to get them thinking about what they're thinking about. Because if they were to tell you, oh yeah, I'm having all kinds of thoughts about what a mess I am and how I've caused so much pain in this family, and it seems like everybody's annoyed by me, and I just have done things that you don't even know about, then somewhere in the scope of some of those feelings, you would be able to say, you'd be able to dispute that and say, I'm so glad you told me, because that's not true. That, remember when I talked about this last week, there's nothing that we cannot figure out. I know that you've made some bad decisions. I know that you're really overwhelmed with college. I know that you're really overwhelmed in this relationship and you feel like you're just in too deep. There's nothing that we cannot figure out. And if we need professional help, we're going to get professional help. I'm not afraid to do that. I welcome it. I'll help you do it. The visualization that I keep having when I'm thinking about talking about this is this. I mean, this is a true biblical story that I'm about to tell you. And at the same time, the scene, like the visual scene, is coming to me because I've watched The Chosen. I've watched every one of those episodes over and over. And there is a scene in the last episode of season 3 when, so if you haven't seen it, I'm sorry, this is going to be a spoiler for you, but it's in the Bible, where Jesus is walking on the water, and Simon, calls out to him and is like, "Is that you?" And there's just this dialogue going back and forth. But basically, what ends up happening is that Simon is saying, "If this really is you, then call me out to you, because I'll walk on the water. I'll do this. I have enough faith in you that I'll do this." And he ends up doing that. But just as we know from Scripture, he takes his eyes off of Jesus and he starts to look at the waves, because, I mean, my goodness, who wouldn't? These waves are crashing, and it's sort of like this natural reaction of, "Oh my gosh, what's going on?" And he sinks. He just goes straight down, right? But then Jesus's hand comes into the water and grabs him. And that's what I think about, that visualization that is now like they've made it into a famous portrait. It's so beautiful. And I just think that's what I want you guys to be thinking about as we're talking about this and bringing light to a really hard conversation. I want you to think about someone that you love that feels very much like they are drowning. And you are just simply saying, "Here's my hand, grab on." No, you're not Jesus, and I'm not Jesus, and we're not saying any of those things at all. We're just simply saying, be that hand that says, "I will pull you out, and then we'll deal with the rest later." Right? So even if you're someone that maybe you have been frustrated with this person, maybe there's some truth to what they're saying, that they have made a mess, that they've put the family in a really big predicament, or they've hurt the relationship with you as an individual. I want you to remember that our view of forgiveness is supposed to be a very unique one than it is from other people that are not followers of Christ. And we can deal with all of those things. And maybe that's going to be a boundary or a severing of the relationship, but we don't want that person gone, right? No one's really truly going to say that. We don't want that person dead. We just might have to decide, like, this relationship it's not going to be what it was before. But help them to realize that it's okay, that there is help available, that they can turn things around, and that there is always hope. And so that's just what I want you to visualize in thinking about that. You don't have to have everything figured out. You're not going to have everything figured out. But as we've talked about before in this series, it's also an awesome idea that somehow, no matter where you fall on the side of either one of these scenarios, the information of the person who would be the person at risk, their information needs to be given to their support members. And that's a different video that I'll have to do on a different day, talking about your support system, figuring out who those people are, having those conversations, all of that. We'll get to that. But for now, just know that if you're the loved one, you need to have access. You need to have at least the name and the phone number of that person's therapist, psychiatrist, their hospital of choice. If they ever have to be hospitalized, where do they want to be taken to? We get to choose that. And if we don't decide that we're going to choose that, then it gets chosen for us. And sometimes we end up at a place that we just really don't like. But you see how a lot of the messages that I'm giving you in this are thinking ahead, getting in front of whatever could be going on. It does not mean that you are thinking the worst. It does not mean that you are expecting that all those things are going to happen. What it means is if that happens, because we know that the statistics are that 1 in every 10 families, or 10 people, which I guess you could look at it either way, 1 in 10 people will be affected by suicide. Now, when I read that, I think that can mean a lot of different things, right? That can mean that you're impacted by it because it happened within your family. It could mean that 1 in 10 people are going to deal with that. It's going to be a struggle. I don't want it to be a struggle. I want you guys to know that there are always skills that can turn that around, 180 turn that around. So going back to the message that I shared from the family member, This is not in any way designed to make anybody, have any feelings of guilt, or certainly not shame. It's just information. I want you to know that when your brain is filling you with all kinds of distorted and irrational thoughts, consider writing some things down so that your impacted and less functioning self can look at some words that you've written down before and realize what people really think about you, and that you are valuable, that you are irreplaceable, that there have been good days in your life. There have been great seasons where you would have checked in at a 8, 9, or 10. Sometimes we need to remind ourselves of that. That's why you hear therapists talking about journaling so often. And I understand it's not for everybody. There's some people that they just can't get on board with that idea. And I understand that. It doesn't have to be a journal. Just write something. You can call them affirmations. You can call them, positive messages. You can even call it scripture, because there's lots of scriptures that include basically I am statements of what God, how he sees us, what he calls us, who we are in relationship to him. And your impacted and less functioning self needs to see that. So I'm going to move on to something else for a second. Same topic. And this is kind of a different leg of this conversation, I guess, because it took me, I'll be very honest with you, this took me a while of being a therapist, because there's so much of this that I was just coming at it from, just the straight clinical, kind of like one size fits all cookie cutter approach to suicidality, until I realized after, because I'm a big observer. It's just the way that I am. And there's much of it that I really love, and it really works well in my job. I'm such an observer that I've noticed over time that some of the patients that I have been treating, we would try everything I could ever run across to help them get over having chronic suicidality. They had been inpatient, outpatient, therapy once a week, twice a week, 3 times a week, family sessions, changing medications. I mean, you name it, changing jobs, all kinds of things. Lots and lots and lots of skills, only to see that person is still, it's still a default. And see, that's the key word. When I realized that it was really becoming more of a default for the patients I'm talking about, than it being a, I'm super depressed and my thoughts are very irrational, and it's leading me to just have constant intrusive thoughts of suicidality. When I realized it didn't fit that profile and it was a little bit different, I realized that for some people, it has become habitual. In other words, it has become a coping strategy. And those conversations can be really difficult, but some people need to know that. They need to hear that, and they need to realize, because therein lies hope. Do you see that? Like, there is hope in realizing, oh, so this isn't a part of my depression. This isn't a part of my anxiety, that every time I'm feeling anxious to a certain degree, I start really, having these thoughts of not wanting to be here. Sometimes, and this, I'm not going to take us too deep into CBT, because believe me, I could, and I want to. But that's why I created a whole program for that. When you realize that your irrational thoughts keep supporting that belief, then you realize it's become a coping strategy. What I mean by that, just to break it down one step further, is when something comes at you that is really challenging, it's really difficult, you feel overwhelmed by it, you don't feel confident, you don't know what to do. Sometimes, or let's say there's conflict. There's conflict between you and somebody else. And your tendency to want to avoid the conversation or avoid the awkwardness requires that you need some sort of defense mechanism. Like, something has to step up there, right? Because you've already told yourself, I don't want to do that. I don't know what to do. This is so awkward and painful. And I hate conflict so much, that you can set yourself up to have the default of, I just don't want to be here. Maybe you haven't developed a plan and you have everything like laid out of what you would do and how you would go about it, and you don't have access and all of that, but your thoughts are walking you there. Your thoughts are already sounding like, here's an option. When all else fails, I'm so upset that people don't like me, I am constantly running into my humanity and I just can't do things right. And this is so embarrassing. This is such a humiliating place to be. Then we can see that those things have really paired out, right? Because I don't have the healthy coping skills to help me know what to do. I just want to avoid it. And that is, in so many ways, it is an ultimate avoidance. I mean, I'm saying this as a clinician from experience, where I've actually I really listened to people's thoughts. And sometimes I hear them say things like, they, I'm trying to be careful about the way I'm saying this, because this is not the case for everybody. This is so not the case for everybody. But I want you to know, in my attempt at trying to address as many nuances about suicidality as I can in this short series, I also want to say this. Sometimes a person, without realizing it, they start to become like passive aggressive. Their family is really frustrated with them. Maybe there is conflict of all levels, and their thought is, I'll show them. Or here's my backup plan. I've heard patients say that. Well, here's what I plan to do. If you're hearing this today, chances are you realize how irrational that is. That is a very permanent situation to something that might be hugely temporary, right? You're going to be able to work through the conflict. Most families do. Most families work through the conflict, but in that moment, if you're someone that has a super hard time tolerating discomfort, awkwardness, people being mad at you, that can feel like eternity. It can literally feel like, I don't want to keep experiencing this. I don't know how to change my feelings. I don't know how to identify them. I certainly don't know how to de-escalate them myself. Can you see why that would make sense to somebody? Because their reality is, this is so painful. This is so uncomfortable. This is so awkward. This is so embarrassing. This is so permanent, is how they see it. They cannot see how in the world would this ever change. So this is why CBT is important. It saves lives. I can't tell you the stories, of course, because everything I do is confidential, but I just want you to know, I promise you, it has saved lives. Because helping someone, after everything that we have been talking about just tonight alone, how much of that did I prove to you originated in thought? Thoughts are everything. They are literally everything. There's nothing that happens from our personhood that did not start with a thought. There's things that happen around us, of course. No, that was their thoughts. I'm talking about with you. There's no decision that you make. There's nothing that is truly impulsive. There's no depressive episode that just, boom, hits you. I'm talking like outside of tragedy and outside of like a true crisis that can change your world in an instant. And I know that. But outside of that, every single thing starts with a thought. And so they're important. They're more than important. They are vital. And the only way to really understand your thoughts to the degree of what I'm talking about tonight is to go on that deep dive that myself and other therapists call cognitive behavioral therapy. You have to understand your thoughts. The way that I have been able to have the most success stories with my patients that have struggled with suicidality, it all came down to what they learned from CBT. There wasn't anything else. Did we talk about a lot of spiritual things? Absolutely. Absolutely. And I realized that what made their CBT explode was incorporating their faith to it. Because faith alone, talking about things from a faith-based perspective alone, when we're talking about suicidality, I know some of you, if you could, raise your hand and share your story and you wanted to, you would. Because what I have heard is that talking about suicidality and only using faith-based techniques can come across as guilting or shaming somebody. I'm going to say that again. Helping somebody to change their suicidality, their patterns of self-harm of any kind, only using faith-based techniques can come across to that person as guilting or shaming them. It comes across as, if you had more faith, if you knew the Bible better, this wouldn't be happening. If you just called on Jesus more, why don't you trust him? Why would you want to hurt his feelings by, destroying your life that he gave you? But it's when those two things come together. I think the Bible is wonderful, and I think it's perfect. It's the infallible word of our Lord. And it's inspired. If it's not spoken by him, it's inspired. It is perfect. Make no mistake of me believing that. I just know what history has shown us. I've seen so many patients that have come to me as a second, third, or fourth therapist, and they're telling me, here's where it didn't work. And I listened. I paid attention. And I realized that psychology is brilliant. It's God's idea, which makes it brilliant. And when you bring that into the world of faith, now all of a sudden they're not just hearing something like, you don't pray enough, you don't know scripture enough, you aren't trusting the Lord with your life enough. You're realizing that your thoughts bring on every decision that you make. You're realizing that we are living in a world that honors our feelings, that puts all the emphasis in the world on our feelings. Well, how do you feel about that? Well, do you feel like doing that? What if you don't feel like doing that? What if you feel like this, but you're really not that? That's the world we live in. God speaks about that too. Lots of different passages in the Bible are talking about how foolish it is to base your life on your feelings, and how wise it is that your thoughts are meditating on the right things. Philippians 4:8, I think. Whatever is noble, whatever is excellent, whatever is trustworthy, whatever is beautiful, if anything is praiseworthy. I think I might be missing some adjectives there, but it says, think on these things. I love that passage because it is showing the intentionality that it takes to have a good, godly thought life. We can't just let anything come to us just willy-nilly, right? Because it does, and it will. You have lots of thoughts in a day. But as a trained advocate for your thought life and a godly advocate for your thought life, you have to steer the ship. You have to say, okay, no brain, we're not thinking about that today. That's not me. That's not for me, and that's not about me. You turn the ship to, I'm going to think about God's creation and how he points out himself to us every day in everything. I'm going to find the things I'm grateful for. I'm going to meditate on his word. I'm going to reach out to the people he's put in my life. I'm going to be honest and let them know me and let them be there for me. I'm going to focus on the things that are praiseworthy. And that's a lot, right? Hi, Victoria. I'm so glad you're here too. I've seen a couple of people, not names, but just the numbers going up and down. So the intentionality of our thoughts, right? That's a big deal. That's one of the biggest things I ever learned as a brand new therapist. And remember what I said at the beginning of this, I've been a therapist for 16 years. I've been a Christian a whole lot longer than that. And it was absolutely like rocked my world, earth shattering in a good way, to realize, wait a minute, I don't bring on all my thoughts. Like all these things that I think about I'm not bringing them on. And I'm not responsible for them because sometimes they might be really, really dark or really ugly or really sinful. There's so much to be said about this category, about this skill set. It runs so deep and it has so many layers to it. And I don't know what you'll do with it tonight, but I just hope that you do something. Go back and watch the other 4 weeks of me talking about this. There may be some things you don't care for, hold on to everything like it's a sifter and hold on to the things that were good and the things that made sense and the things that you knew God had that in mind for you. Let everything else fall. That's okay. I'm not going to do a perfect job anytime or all the time for sure. But I know that some of these things that I'm saying to you, I know they're coming from a great place because I know me. But I also know that they are coming from story after story and case after case of me learning how to do things the right way, how to save lives, how to get people talking, how to help them see that suicidality and self-harm of any kind is not a coping skill. Does it mean that we have to really get dirty sometimes and really use our elbow grease? Absolutely. It is so much harder to use skills that get you out of that place than to just say, well, I'm done here. I know it's irrational, and I'm not saying anything but loving, kind things about people that struggle with this. I have such a heart for you. If you have heard me share my story, I get it. I have lost people in my own personal life to this, and I get it. And that's why I feel like I have the clout to share this with you and to let you know there is always a way through whatever you are experiencing. If you know that you are at high risk because you come from a family of deaths by suicide, if you know that you're at high risk now because you're realizing that you've just come out of inpatient treatment or residential or like I said, anything that's extended, physical, surgical, whatever, ask for help. And don't expect that the people that are treating you are always going to have the perfect treatment plan and discharge plan for you because they're not. I've been there. I've missed things. I still miss things now. I want you to be an advocate for yourself. If you're remembering on this and realizing, okay, I am probably at risk as a result of this, remember the 2 patients that I'm referring to that came to me out of the most pain they have ever known in their whole lives or ever will. They came to me. Either they sought me out or someone in their immediate family sought me out and said, we need you. I need you to meet with my loved one. I need you to meet with me. I've heard about you. I've heard about, the fact that you're bringing the faith with the mental health. I need your help. And it is okay to tell you that in most cases, people that have lost a direct loved one like that to suicide are always going to need therapy of some kind, of some intensity, because they are always going to be at risk. They're always going to be at risk. And I'm grateful. Thank you, Danelle. Those are true words. It's been a tough conversation and a tough topic. But I know that as a believer, one of the things that God deposits in us is his love for us and our love for people. And I love people. I love people so much. And so this would be a video that I would encourage you to go back and watch again. I said a lot of things in a short time. Write some things down. You can always reach out to me. I put in the notes of every one of my videos, my website, my email. You can comment here. I know that I cannot give you direct counsel, and I don't even know your stories, those of you that are watching this right now. But I hope that I hit a high enough level, like an arch, to just say, look, this is what you need to be doing. You need to get help. You need to know that there is always help out there. We're never, ever, ever going to live in a world that is so bad and so negative that people do not fight for what's right and fight to be able to help people, because God has already promised that his church cannot be held back. And that's us. So thank you for sharing this time with me tonight. I do not know what I'll be talking about next week. I'm always open to suggestions on that. It's really hard, as much as I talk with people every single week, multiple times a week, to come up with new things to talk about, especially if it isn't going to meet the need. So reach out to me if there's something that you really want to hear me address, and chances are I will, and chances are it will be soon. So thank you for your time tonight. God bless you. May he have his hand on you. May he be watching over you. May he draw you so close to him through this video, through reading his word, through anything that you are doing, that you just know you matter so much that he only created one of you, and he gave his son to die in your place because you matter to him that much. God bless you, and I'll see you guys next week. Bye.